Hello everyone, my name is Eric Seidel, and I am here from the Helena Independent Record. It is both a pleasure and an honor to be able to recognize 10 local Helena nurses for their contributions in the healthcare field. Each year, in honor of National Nurses Week, the Helena Independent Record recognizes 10 nurses for their contributions to our community. We solicit nominations for these awards annually. 9 of the 10 winners were chosen by the Independent Record staff, and 1 was selected by our readers in an online poll. 2020 has been a sobering reminder just how much our healthcare workers deserve our recognition. But before we get into our award winners, we need to thank our sponsors. Thanks goes out to Blue Cross Blue Shield of Montana, St. Peter's Health, and to Carroll College for sponsoring these awards. And please make sure to keep an eye out for our special insert on Sunday and for the congratulatory pages recognizing the nurses, which will be published in the newspaper next week. As I said earlier, now more than ever, healthcare workers deserve recognition and praise for what they do on a daily basis. The Independent Record wants to highlight these often unsung heroes for their bravery, devotion, and their determination. Here are the winners of the annual Nurse Appreciation Awards. Carol Burstad. Carol wanted to make a difference in people's lives, so she found a profession in which she could do exactly that. Burstad has been a nurse at St. Peter's Health for the last 3 years. She worked all over the country in places such as Texas, Georgia, and Wyoming before she came to Montana. Since joining the staff at St. Peter's Health, Burstad has worked as part of the surgical unit, where she takes care of people after surgery. While Burstad loves her profession of 30 years, the hardest part is when she wants to help somebody, but is limited as to what she can do. Burstad resides in Helena with her husband Bill and has 4 kids. She enjoys spending time outside in her free time. Carol, thank you so much. Katie Cloninger. Katie is our next Appreciation Award winner. Katie works at the Cancer Treatment Center of St. Peter's Health. It might not be the easiest nursing job, but she says she loves every second of it. Cloninger started working with oncology patients in 2005 for Dr. Thomas Weiner and has helped treat every type of cancer imaginable. She primarily works with adults, but she's also worked with children. Cloninger graduated from Carroll College in 2004 and has spent the last 15 years working at St. Peter's. She said she wanted to be a nurse since she was in the 3rd grade. Before Cloninger was at the Cancer Treatment Center, she worked on the surgical, pediatrics, and oncology floors. Outside of work, Cloninger and her husband have 2 daughters who are Irish dancers who they follow on their dancing circuit. She also likes to go to her family's cabin at Canyon Ferry Reservoir to get outside and exercise and to walk her dog. Katie says family is very important to her and that she enjoys spending time with them. Katie, thank you so much. Now on to Elise D'Marie. Elise says she didn't know what she was getting into when she applied for nursing school, but it turned out to be a profession she loved. D'Marie is new to St. Pete's Health. She was hired this past August as a circulating nurse. She grew up just north of Seattle, but knows Helena pretty well, considering that she received her nursing degree from Carroll College. While D'Marie has experience in other types of nursing, she prefers to be a circulating nurse. But her profession isn't without challenges, and said that one of the hardest parts is getting information out to people. D'Marie has been back in the Helena community for 10 years now, and every time she drives by Carroll College, she thinks back to her journey to St. Peter's. She says that she tells people that nursing is a great profession. Elise said the profession is very diverse, you can have a desk job, and that you can work with a broad spectrum of people. You can change jobs easily, and you will always have a job. She said that if you're a caring person who loves to help people, it's the perfect job for you. From all of us here, thank you, Elise. Next is Edie Neal. Nursing runs through Edie's veins. A licensed practical nurse for about 25 years, Neal said it was her mother, the only nurse and emergency room technician on the South Dakota reservation Neal grew up on, who inspired her to choose this career. Neal got married, had 4 kids of her own, and went back to school to become a nurse. She and her family moved to Helena in 1978, and she now works at Associated Dermatology and Skin Cancer Clinic of Helena. For Neal, seeing patients who have struggled for years with debilitating skin conditions finally find a cure is one of the most satisfying aspects of her work. Edie says that most patients are extremely grateful because they've been suffering for a long time, and she said it's rewarding just to hear that they're healthy and feeling better. With much of her career in the rearview mirror, Neal says she plans to keep at it for at least another 5 years, but she is looking forward to retirement. She said she plans to travel and spend more time outdoors once she hangs up her scrubs for good. Until then, Neal said she will continue to do the best work she can for her patients, work that has meant a lot to her. Thank you, Edie Neal. Kim Johnson. Kim is living proof that it is never too late to try something new. A longtime courtroom stenographer, Johnson said she was carrying too much job-related stress home with her at night. That's when Johnson called a family meeting. Her husband and their 3 daughters discussed the prospect of Kim going back to college. She left her courthouse job and put aside her work with her husband. The two are co-owners of Fire Tower Coffee here in Helena. And then she enrolled in Carroll College's 4-year nursing school. She said many of her instructors and classmates were much younger, and that it took some getting used to, but she said she learned her younger classmates would exchange computer advice for dating advice. She said the move has paid off. She graduated last May, and shortly thereafter began her career at Touchmark on Saddle Drive in an assisted living facility. She said one of the most important and often rewarding aspects of the job is lending an ear to residents who just simply want to chat. The patient who nominated Johnson for the Independent Records Nurse Appreciation Award is very close to her. Kim said there aren't many days that the patient doesn't stop in her office, coffee mug in hand, just to talk. Johnson credits her colleagues for the good work she's able to do. She said a tender heart is necessary for her profession, and each of her coworkers has one. Kim, thank you so much for everything you do. The next award winner up is Jolie Silk. Jolie is a behavioral health nurse and quality improvement coordinator at Pureview Health Center here in Helena. She is the award winner for our Reader's Choice Poll Award. Silk said her profession provides her with a blend of direct patient care and process improvements that she really enjoys. Nursing is a career that Silk said is very gratifying. However, it took Silk a while to land on nursing as a career. Silk previously worked as a park ranger, a locomotive engineer, and as a systems administrator, but these jobs just weren't the right fit. She says nursing comes with its own set of challenges, and that the biggest one is ensuring safe work conditions, which includes maintaining reasonable staffing levels and having access to proper equipment. Silk said this has been of particular importance during the COVID-19 pandemic. Silk said the opportunity to be a part of a community health center is what inspires her to do such a difficult job every day. And it's Pureview's mission statement to provide quality, comprehensive health care to everyone that helps keep her motivated and interested. For everything you do, thank you so much, Jolie. Next up is Kaylee Köppen. Kaylee Köppen is the Deputy State Surgeon for the Montana Army National Guard. Köppen's primary responsibility is ensuring the day-to-day medical readiness of soldiers in the Montana Army National Guard, both stateside and in preparation for returning from deployments. Köppen transitioned to working for the National Guard as a registered nurse in 2015. She said this came as her family was growing and the opportunity presented itself. Köppen said the hospital and the Guard are very different, but she has loved both positions for many different reasons. Kaylee says she loves her career as a nurse. Köppen said that being able to advocate for soldiers is a big part of what keeps her going every day, whether they are getting an annual health assessment, preparing to deploy, or for getting follow-up care when returning home to Montana. Köppen is there. Köppen said being able to facilitate care for soldiers while giving them and their families peace of mind is a great reward. So for everything that you do for the Montana Army National Guard and for our community, thank you, Kaylee Köppen. Next on our list, Karen Roundell. Karen Roundell is a nurse and the head of the Public Health Department in Jefferson County. Roundell's duties include budgeting, grant reporting, disease control, immunizations, maternity and child population nursing services, and even emergency preparedness. Despite her profound love for her work, Roundell didn't get her start as a nurse or even as a healthcare worker, rather working in a biology research lab. When the lab she worked for moved its operations to the University of Minnesota, Roundell decided it was time for a career change. She was interested in healthcare and was hoping for a stable paycheck. That's when Roundell returned to school to earn her Bachelor of Science in Nursing. Karen worked as a county nurse in a small public health department. She said this allowed her to perform a wide variety of duties and work with many populations and agencies, including students in schools, patrons at a senior center, families using WIC services, emergency response partners, and the local clinic and hospital. Roundell eventually ended up in Jefferson County, which is where she is now facing her biggest challenge yet as a nurse, the COVID-19 pandemic. Roundell said that over the years, she has found it challenging to motivate people to be prevention-minded in their personal health habits. This includes decisions related to smoking and vaping, relationships, and vaccinations. Congratulations, Karen Roundell, and thank you. Priscilla Cates is the Clinical Nursing Supervisor at Pureview Health Centers here in Helena. Cates' job is to supervise nursing staff at all 4 Pureview sites. Cates said she's proud to be a part of a profession that impacts the lives of so many people. Throughout her career, Cates has worked as both a staff nurse and as a traveling nurse in a variety of different positions. Cates said there's no other profession that offers as much variety as nursing does. Cates said the number one issue facing nursing right now are a lack of resources, such as medical supplies, healthcare coverage, and even providers in specific fields. For everything that you do, thank you, Priscilla. Next up, we have Sarah Peterson. Helena nurse Sarah Peterson has made it her life mission to care for the most vulnerable among us, and is our next Appreciation Award winner. Prior to her career in geriatric nursing, Peterson taught grade schoolers in Colorado. She's also taught English as a second language to people in Ecuador, Vietnam, and South Korea. She and her husband are also parents of 3 adopted Vietnamese children. Throughout her nursing education, Peterson developed an affinity for geriatric nursing, and now is the nursing manager at the assisted living facility at Touchmark on Saddle Drive. She takes great pride in providing care and dignity to people at the end of their life. Peterson said one of the biggest benefits of geriatric nursing is the ability to form long-lasting relationships with her patients and their families, something not afforded to the likes of emergency room nurses, for instance. It's the human connections that Peterson said motivates her. She encourages every member of her staff to spend at least 5 earnest minutes with each Touchmark resident a day just to simply listen. Peterson says she manages 4 other nurses, 4 caregivers, and 2 medical technicians. In speaking with her, one quickly understands Peterson treats those under her watch with the same humility and care as she does her patients. Sarah Peterson, thank you. That completes this year's presentation for our annual Nurse Appreciation Awards. A big thank you to our 10 recipients of the awards this year, and also to all those who serve in the healthcare field. Another thank you goes out to our sponsors, Blue Cross Blue Shield of Montana, St. Peter's Health, and Carroll College. One last reminder to keep an eye out for the special section on Sunday in the newspaper, and also for the congratulatory pages recognizing the nurses, which will be published in the newspaper next week. We hope you enjoyed the presentation. Thanks so much.